Welcome back to another conversation with AcroPsych, where we create educational, inspiring dialogue around psychiatry and addiction. I'm your host, Dr. Matt Campbell, and today I'm really excited to be joined by Dr. Sharon Martin. Dr. Sharon Martin is a licensed clinical social worker with a doctorate in social work. She's written multiple books, including one you'll see behind her, CBT Workbook for Perfection, as well as the Better Boundaries Workbook. She provides psychotherapy within her practice in Northern California, where she specializes in helping adult children who had parents with alcohol use disorder and others who struggle with anxiety, perfectionism, and self-criticism. Sharon, welcome to the show.
Thanks so much. I appreciate you having me on.
Yeah, excited to get into it. If we can start giving people a little bit of a brief summary of what the kind of work is that you do.
Well, as you said, I am a licensed clinical social worker, and I've been working as a psychotherapist for, 25 years. At this point, I really specialize in working with adult children who had broadly dysfunctional family systems. So that can look like a variety of different things, but certainly many who grew up with parents who struggled with substance use issues or mental health issues. What they recognize when they come to see me is that they're still struggling with some of the effects of that, even though they're, often in their 30s, 40s, 50s, or 60s even. I think we often like to think that we will maybe just outgrow some of the effects of those behavioral patterns that people acquire, the coping strategies that they learn in children, and the emotional impact that has on our thinking, our self-worth, the way we relate to other people. That follows us into adulthood, understandably. And then people often recognize, this is showing up in my intimate relationships or my friendships or at work, or again, just in the way that I feel about myself and my ability to accomplish the things that I want in my life. So that's often how people show up, wanting to get to the root of some of that and figure out how they can free themselves of those effects that started pretty early on for them.
It takes a good social work background to recognize that the environment is so important. I'm on the medical side of things. A lot of our medical training, we can be a little bit more reductionist or looking at things very symptomatically. You add a nice perspective of saying this entire environment that we grew up in is creating all of these changes, all of these impacts for where we're at right now, our current problems. I wonder if you could give me a little bit of a background of your training, how it helped shape that kind of view for you.
I would say maybe the sort of most foundational piece of social work education is this idea of person and environment. I would say it is often tempting to just look at individuals sort of in isolation, right? Because that's the way they show up to us, is just them usually in the room. And some of this is, again, the result of these family systems. It almost teaches us that what's happening to me is a fault of mine, something that I have done wrong that has caused this distress, these symptoms that I'm having. And part of what we're trying to do is help people understand that while you are experiencing this as an individual, it is a symptom of what's happening in your environment or what did happen. And we are all products of our environment. And this is not just our family environment, but, we can even look more broadly at the neighborhood, the community, everything that's happening around us is happening to us. And I think that's really helpful for us as practitioners to understand our clients or patients, but it's also helpful for them to understand that this is not something that is happening because of a deficit within you, right? And so that helps to start alleviate some of that shame, guilt, self-loathing, self-criticism, that feeling of there's something fundamentally wrong with me that has to be fixed. And so certainly there is a place, sometimes a big place, for some shifts in our individual thinking and behaving, but it really does help everybody, I think, to understand that there's more going on than just you as a person in isolation.
Absolutely. And that's why it's so great when we have the opportunity for more of a team within psychiatry. I think we can all get very siloed, but the value of having that kind of perspective within the team, I think, helps give us the most ability to really help the patients address what's going on. And I'm wondering if you'll let me go through like a clinical example. So, as a psychiatrist, I have a patient. There's a patient who I think could benefit from some of what you're talking about and is seeing PTSD and relationship challenges. She grew up in a family where there was a lot of dysfunction. There was a parent in the household with an alcohol problem, and that parent has been someone whose presence is not always felt, like not always there, not always around, not always consistent. As this child has become an adult, there's been a way in which the child is always taking care of the dad. The dad is not always telling the truth, lying about medical problems that he doesn't have to get attention and care from this daughter. And this daughter is trying to figure out, how do I even navigate this? And it seems to really exacerbate a lot of her PTSD symptoms when something's going on with the dad. What kind of things would you tell her as far as like how the treatment would start with you and what you'd be focusing on to help her?
I'll give it a whirl here, Matt. I mean, one piece that I'm missing is what is the client, the patient seeing as the issue? What does she really want to have be different in her life? That's usually where I start with people, is trying to understand, if things were to be better for you, what would that look like? What are the specific things that you would like to be different in your life? But one of the things that stands out to me, or I would say is probably a theme, in clients that I see who have similar backgrounds to this woman is that there's a focus on the father and what the father needs and taking care of the father. And usually when that is happening is the flip side is somebody is not focusing on what they need. They're not in touch with what do I need, and that it's okay for me to have needs, number one, and then go about meeting those needs. So there is sort of an over focus on the other person's needs and keeping them happy or safe or well, whatever that, looks like for the individual, and not enough on prioritizing oneself. And so I really think about this as trying to bring some balance to this. It's not that we don't want to care about other people and their needs, especially a parent or a family member, somebody who's obviously important in your life. So it's not as if we're going to suggest, forget about your dad. He's a grown-up and he can take care of himself. It's probably not realistic for somebody to go to that extreme, right? We're trying to find that place where we can prioritize our own needs, take care of ourselves, and feel like it's okay for us to do things in our lives that are going to be fulfilling for us, are going to bring us happiness. So that might be one piece of it. One of the things that often happens is when somebody is in this caretaking role with the parent or somebody else, is that, again, they're not just not taking care of their own needs here, but sometimes their other relationships get neglected. So if there is a partner or if there's children, those people in this woman's life might also feel like she's not showing up and being as present for them if she's doing a lot of this caretaking for her father. So that might be another piece where there could be some shifts, again, to try to, again, just bring some balance back into all of those relationships. Another theme that might be here is that we're sort of interestingly have the childhood experience of what sounded to me like some level of emotional abandonment, or the father who wasn't, maybe even physically, he wasn't there for her, and now in adulthood she needs to be there for him, right? So it almost feels like she's trying to have some sort of corrective experience here where she needs to have this connection with her father who wasn't there, and trying to get some emotional needs met that weren't met in childhood, whether that's love or approval, something along those lines. I think there might be a thread there that's worth exploring to see what might come up around that.
I think speaking of that thread, I'd be interested to hear how to have these kind of corrective experiences for her with everything that she's been through. From my perspective of what the relationship's like with the parents, I don't know if that corrective experience is going to happen with the parent. And I'm wondering if you could speak to when people do come from dysfunctional families. I think there's always this balance of wanting a relationship, that these are still our parents, and yet at some times there isn't the possibility of that full corrective experience, that healed relationship that we would like to see. And how do you work with people in balancing that kind of like wall that they're stuck in between?
I mean, you really hit the nail on the head, because I think this is often what happens is they're really trying really hard to be able to have a different kind of relationship, get those emotional needs met from somebody, when it's probably unlikely that they're going to be able to get that, at least not fully. And so absolutely, we need to also sort of work in the space of reality and work towards some level of acceptance of what the reality is, what that other person is capable of in this relationship or willing to give in the relationship. We're talking partly about there being some denial about maybe what's happened, and sometimes about the depth of the pain of those early experiences, perhaps the denial of what is really happening right now. I would really try to just have some of those conversations where there's both a lot of empathy for the experience and the feelings that are coming up, but also the ability to sort of gently confront that and say, what's happened in the past when you've tried get some approval or get some acceptance, get some love, and how has that gone? We need to understand that unless somebody is giving us some very specific information that they have changed or that something is different, it's probably going to be a repeat of what has happened in the past. This is where some of the denial and that wishful thinking comes into play. We want people to be different, and often they're telling us that they're different, or making promises that we want to believe things are going to be different. They're going to be able to show up for us or be really interested in it and give us the emotional stuff that we're looking for. But there has to be something concrete to back that up. There has to be evidence of some behavioral change to go along with that. Otherwise, people just get hurt again and again.
So it's kind of them having some form of a boundary for themselves and recognizing that what I may want, what I may desire, may not be available to me at this moment and in this relationship.
Right. Once we can accept, like in this situation, if this woman is not going to be able to get these emotional needs met from her father, then what? Right? That's sort of the next piece of it. Because again, that's a very painful, acknowledgement. When you get to that place of accepting that your parent has limitations or that things haven't changed, there's going to be a lot of pain and grief around that. But then we're still left with, what do I do with wanting to have that corrective experience that now I see is probably not going to happen? How do I still have a relationship with dad if I want to? But here's where I would try to make that shift at this later point in the treatment is how can I get those needs met without dad's involvement, right? Because I'm not going to keep going back to him once I understand that he's not going to be able to give me what I need. And so a big part of this is, how can I do this for myself, right? How can I be my own loving parent? Or if that doesn't resonate with somebody, how can I meet my own emotional needs? And a lot of our needs we can meet for ourselves, but there are also needs that we have that are certainly relational in nature. And so that also might be, how can I cultivate other healthy relationships in my life where I am going to have my needs met, rather than, again, repeating a cycle of going to other people who also are going to not show up for me emotionally or going to hurt me emotionally. Because again, that's a big piece of what happens for people, is we just repeat that same pattern with new people in our lives, always sort of seeking this emotional stuff from people who aren't able to give it to us. And so we want to be able to break that pattern, and that has a huge impact on both the healing of those wounds and also just our fulfillment in life, right? Having healthy relationships is such a cornerstone of feeling good in our lives.
And from what I remember in more of the psychodynamic training that we had, you're talking about this parental relationship may not to actually get the healing that I'm looking for. Where am I going to get it? I'm having trouble with all these romantic partners. The work with a therapist may be that first real healing experience for the patient, where they're able to actually know what that feeling is, to know what that feeling of care can be, where a lot of that healing may not be explicit in what we're talking about, but underneath the surface can be a big part of the treatment. I see you nodding. What's your take on that idea?
I mean, I completely agree with you, and I really appreciate you saying that, because I think it's very true. And I think also, as we have moved more towards managed care and short-term treatments, that this is sometimes what is lost. Things like establishing a trusting, empathetic relationship with the therapist is not something that is going to be that effective in, 6 sessions or something along those lines. It just takes longer, especially for folks who are going to be reluctant to be vulnerable. Totally understandable. The most powerful piece of therapy is developing that relationship and how healing it can be. I think for folks maybe coming into therapy for the first time, it might sound sort of strange or odd to them, but it is a unique kind of relationship, and I think it's hard to explain to people what that is like until they've had that experience. But as somebody who has also been the client and has been to therapy as well myself, there is this relational component that you have with a therapist that you sort of just know when it's right. And sometimes it takes going to a couple of different therapists before you find the one who you really feel comfortable with. And again, I don't necessarily mean that happens just after one visit with them. But I do think for most people, after 1 or 2 visits, you at least get enough of a sense of that therapist to say, this seems like somebody I might be able to connect with, or I might feel comfortable with. Or I sort of like that approach that they have, or their sense of humor, or something about them that is coming through that feels okay to me. I mean, I really do believe there is a tremendous amount of healing that's this relational, piece of the experience. Yeah.
Relationships are such an important aspect of every person's life. And we're talking about from a therapy point of view, working with a therapist. I'm usually working with someone who has an active substance use problem. And so much of the time we're trying to figure out what's really important to them. What's the motivating factor? What's the driving piece to make such a big change? Because within a substance use problem, there's a lot of weight pulling us back towards the old pattern of behavior. So to make that shift, I would say relationships, medical or health, and job are kind of the big 3 most common things that I will see people really connect to. And relationships, I would probably put at number 1 of those when there is an aspect of a relationship that we can work on. Sometimes that's a spouse. When it's a child, I think that there can be some really powerful healing. People really want to be there for their child or have a relationship with their child in a way. Say I'm working with an adult who has really created a dysfunctional life for their child as they grew up, and they're now older, and they're both trying to navigate this. So I'm with the father and you're with the daughter, and we're trying to figure out, how do we navigate this? What kind of things would you see from the daughter's perspective that she would be going through of how to heal that relationship? And then I can add what the dad is going through as well.
The daughter's perspective, I think what she needs is to see that there is something that is really different about what the father is doing this time around. And again, chances are that the father has tried to get sober at some other points in time. It's super common that people make multiple attempts before it sticks, or that there have been times where he's tried to get things under control. And so there's a lot of hurt and mistrust around just that piece of it alone. And so I want to help this client not set herself up for another heartbreaking experience of, I'm trying to heal this relationship with dad, only for dad to sort of have a repeat of what's happened before. Maybe saying, "Oh, I'm changing. I'm getting clean. I'm on my meds. I'm addressing these things." Only for next month he's dropped out of treatment, or where he's relapsed and so forth.
Like
She's gonna need some reassurance that, hey, something's different. Like, why should I invest in all of this work to try to heal this relationship and improve things with you if you're not fully committed? And that's hard because I think there's an element that it just takes time.
I definitely hear what you're saying on that side of things, and the time that it takes and the regaining of trust that the child is trying to wrestle with. I think a lot of times on my side of it that the patient is wrestling with a ton of shame, and really any of these setbacks, how much embarrassment, shame that they feel that they're not able to stop, that this drug is doing something to them that they're not able to at least control in that moment, or they're making some choices that aren't aligned with who they really want to be. And especially with a young kid, knowing how much that they missed in their childhood or how they may be affecting their kid, there usually is so much shame. And I think that these interactions then become so delicate because any sign of the father messing up, I imagine the daughter is worried, here we go again, that nothing's changing. The father is seeing the daughter react that way, and he's feeling more defensive, more ashamed, more hurt about what he's done, and tends to then isolate even more. And I see these kind of patterns like very much get stuck in a rut over and over again, where the relationship kind of both sides are wrestling with this thing, and then it gets stuck in this rut.
You've made such a great point about the shame and how big that is in these dynamics. And what ends up happening from the child's perspective is they don't recognize the shame that the parent is feeling because it is never spoken of. All they have is either the parent, like you said, pulls back, retreats, or they become angry and lash out at them. When you're looking at it through the lens of shame, it's completely different. And I think that if that could be spoken of, that if the parent in this situation could actually name that that's what's going on and talk about how the shame leads to the behaviors that we're seeing, right? There's a real level of vulnerability that is required for that to happen, which of course is why it doesn't happen so often. But I think that could really change the dynamic in these situations for the child to be able to understand that what they're seeing isn't, my parent doesn't care about me, or my parent is angry at me. Something along those lines is what they're often feeling, instead of understanding that the parent feels deeply ashamed and they're horrified at their own behavior and they just feel completely worthless. So that's a really different take that they could have there.
I think that's a really good point that you spoke to about the vulnerability, because when it seems like the parents do reconcile more, it tends to, one, have more sobriety, so they tend to be doing better in recovery. But I think the other piece that you talked to is I think that they end up having more vulnerability and honesty with how they start communicating with their child about some of the challenges, creating some space for some of the hurt that the child has had, some of the lack of trust. And when there's actually space for that kind of difficult conversation, that kind of vulnerability, it seems like the father or the parent is getting a lot more what they want, which is a relationship with their daughter. And it sounds like on your side, the child is also getting a lot more what they're looking for.
This is where it gets really tricky, because you can see so clearly from the outside that both parties here have the same need and desire, but it becomes in conflict with each other because the parent here is understandably so defended against feeling the shame because it hurts so much. I mean, I can really only imagine just how painful it would be to have your child telling you all of the hurtful things, all of the pain that you have caused them over the years. Just right, how gut-wrenching that would be for the parent, that you really have to have a tremendous support system there to help you get through that. And again, I mean, if your sobriety is at all wobbly, it seems very obvious, like this could be a huge setback in your sobriety. My child has confronted me with these things, and it's so painful that I either want to go back to using substances, or I just go back into this denial and this defensiveness that then undermines the relational work that we're trying to do, because the child is asking me to take ownership of this, to acknowledge their pain, and instead I'm either saying, no, that didn't happen, you're overreacting, you misunderstood, or again, I shut down and I get angry, and and we have a rupture in the relationship, which is, the opposite. It's completely counterproductive what we're doing. What we're talking about to move forward in the relationship absolutely is going to require the parent to take ownership and face the shame, right? We're really asking them to acknowledge what they have done or not done that needed to be done. This is a huge issue that I see with the clients, the adult children that I work with, is that they feel like their parents won't take responsibility for the harm that they have caused them. They won't apologize for it, or at least not in a meaningful way, act up with some behavioral change. So it ends up feeling like a dead end for them because they don't know how to have a healthy relationship when the parent seemingly just wants to gloss over it. They just want to move forward. They just want to, sort of have a fresh start. And the child, understandably, needs for them to say, I'm sorry, I understand what I did, and I take responsibility for that, and do that repair work as well.
When you talk about them not getting that from the parents, we're working towards an ideal, but we're not really getting there. For the child, there seems to be this kind of stuck point. They're needing more boundaries for themselves. What kind of ways would you be working with them of setting up healthy boundaries in that family?
I think boundaries are based on our needs. So this is where I start with people. I mean, sometimes people are just sort of setting boundaries willy-nilly without any real plan. Boundaries are very much a buzzword, so everybody needs boundaries, and we understand that. But really what we want to do is think about, what is it that I need in this situation or in this relationship that's not happening? And then that informs the boundary that I need to set here. Sometimes getting that need met is going to ask the other person to make a change or to do something so that I get that need met. So that could look like I'm saying either please do this or please don't do this, that, this is not okay with me. But oftentimes the boundary can be set by changing ourselves, saying, what do I need in this relationship? And then thinking about, well, what is it that I can do to get that need met? If we're talking about a relationship with somebody either not that interested in your needs or, not capable of it, or we don't want to keep asking them, that's the setup of us getting hurt again. If I'm going to keep asking you to change something and you don't do it, it's not going to be a successful boundary, number one, but it's also going to feel really lousy for me to ask you to meet my needs and then you don't do it. It's very empowering when we recognize that, hey, boundaries don't have to be about asking somebody else to do something different.
You started off with saying it's a buzzword, and so I started imagining all of the ways in which I hear people talk about boundaries. And I got to admit, I think I have my own reaction to the word boundaries because I'm used to hearing it from other people. And to me, a lot of times it's actually, you talk about needs, but it's like someone maybe being a little bit selfish and they will throw out all of their boundaries, which in a way to me feels like they're not quite as open to other people. And they're like very rigid about their boundaries. And I'm wondering if you could speak to some of the ways in which maybe you see people getting boundaries unhealthy or wrong or a little bit overzealous in some way that's not necessarily serving them in a good way.
Yeah, there's a few different ways that sort of boundaries go wrong, if you will. And it can be these two different extremes that you were mentioning. One is that people have overly rigid boundaries, and the other is they have just inconsistent or boundaries that aren't strong enough. So again, this is a place where, again, we want to try to be in the middle with it and trying to understand, when do I need to be really firm with my boundaries? Sometimes that's certain people in our lives who tend to violate our boundaries or have hurt us. We need stronger boundaries in those situations. But there are a lot of places in our lives where we can have very flexible boundaries. And sometimes we don't realize this because we're not even thinking of these as boundaries, but they are, right? Boundaries are limits that we're setting or that we have, either for ourselves or with other people. And you can think of them sometimes as rules that you set. A simple way to think about this is parents have boundaries with children, right? Limits or rules that they set for their children. And in some situations and with some kids, those need to be really hard and fast and very clear, and they never change, right? There's no room for negotiation on certain boundaries. Usually these are boundaries that are about safety issues, right? That's where we need strong boundaries, is to keep people safe. But a lot of boundaries can be flexible. they need to shift, they need to change depending on the situation, the circumstances, and just over time. I mean, certainly with kids, kids mature and they grow up, and so we can't have the same boundaries with 2-year-olds that we have with 12-year-olds, right? It wouldn't make sense. As relationship changes with the same person, your boundaries with that person might change because the relationship has changed or the individuals have changed, so forth. There's a place for flexibility, and there's also a place for negotiation in a lot of relationship boundaries. If we think about in general about healthy relationships, is we discuss things. We come to agreements together about what's going to work in this relationship, about how am I going to get my needs met? How are you going to get your needs met? Right? How are we going to do this together as a couple or as a family? It's not going to work really well if one person is over here dictating this is how it's going to be all of the time. And again, there might be a few non-negotiable boundaries where that's important and that needs to happen, but the majority of them need to be understandings or agreements that we have come to together so that we're all on board. And sometimes that means there's compromise. This is just a reality of relationships, is sometimes I need to put my needs on hold, maybe temporarily, so that you can get some of your needs met, right? Or it's I'm getting all of my needs met right now, but, maybe tomorrow it's all about your needs, right? There's that give and take that happens in the relationship. And I think one of the things that people get wrong about boundaries is they try to use it as a way to control somebody else. And that's that place where they're coming in saying, I need this, this, and this, and you have to do it this way, and you have to give it to me. That's not going to lend itself to a healthy, satisfying relationship for anybody. And of course, you're going to get resistance if that's the approach that you're taking.
It, to me, sounds like part of creating healthy boundaries is knowing your own needs, what you need, understanding what other people may want and need, understanding your own non-negotiables, like what are the things that I have to be very, very strict about, and then the openness and flexibility in the middle of how do we work with the others. Is that a fair summary?
Yeah, great summary. Yeah.
Great. Well, I really appreciate all of the wisdom you've been passing on to myself and everyone listening. Do you mind giving some information about where people could find you if they wanted to learn more about the work you do or any of your books?
Yes, thank you. My website is livewellwithsharonmartin.com. So all of my information is there, and I've got a lot of articles and resources for folks around these topics. And then the books that I've written should be available from whatever book store people like to go to. They're available online, and there's not that many in-person bookstores anymore, but if you are fortunate to have one in your area, look there or ask them to order it for you.
Well, I want to wrap things up today for another episode of Conversations with AcroPsych. We appreciate Dr. Sharon Martin taking the time, joining us today, providing so much valuable insight on how adults affected by parents with alcohol use disorder or substance use disorders can heal. And please share this with any friends, family that can benefit from the information, and we'll see you next time. Thank you for listening to this episode of Conversations with AcroPsych. I'm your host, Dr. Matt Campbell, and I specialize in psychiatry and addictions. If you have questions about psychiatry or addictions, I host a regular Q&A for therapists, providers, and the general public. You can find more information about us at www.acropsych.com or on all major social media platforms at AcroPsych. We kindly ask you to subscribe to this channel on YouTube or rate us 5 stars on Spotify, since it helps expand our reach and inspire more of our audience.
This episode and all material is purely for general education and not personal medical advice. It does not establish a doctor-patient relationship, and we recommend you working with the appropriate physician or other healthcare provider before applying it to your situation.